Dr. Geiger, do you have a favorite procedure?
Good question. I do. It's actually a combination of a few procedures, and collectively that's what we call a mommy makeover.
I love a mommy makeover. That's probably one of my favorite procedures, or combination of procedures as well.
Yeah.
Can you tell me really what goes into a mommy makeover?
Absolutely, yeah. So a mommy makeover is really a combination of at least two procedures. That's going to be something with the belly and then something with the breasts. And the whole goal is to get you back to that pre-pregnancy figure in appearance, or even better. So pregnancy causes a bunch of different changes to the body. In regards to the abdomen, we got to make room for the baby. So a lot of our muscles kind of slide off to the side, baby has room to grow, the skin gets stretched out, the abdominal wall gets stretched out. And after post-pregnancy, some women are very lucky and everything comes back together, but a lot of women are left with still a little bit of laxity, a little stretch to that abdominal wall, a little too much extra skin. Sometimes there's a C-section scar that's kind of tethered and some of that skin hangs over. That's really common. We see a lot. So we want to, Tummy Tuck will address all of those things. We'll be able to tighten up the muscles, really get that figure back down, take off that loose skin, make a nice cute new little belly button is always an important part to that, and get rid of that C-section scar if that's a problem in there.
So with changes in the abdomen also come changes with the breasts, as Dr. Geiger alluded to. While you're pregnant, you might have larger breasts than you ever had before. And after pregnancy, they may droop a little bit more than you ever expected. We can fix that with a breast lift. We can reduce the size with a breast reduction, or we can restore the fullness and perkiness that you may want or may have always wanted with an implant and a lift. Or alternately, we could even perform liposuction, take some fat from areas that are less desirable and use that fat to augment your breast for a more natural breast augmentation.
Yeah, and that's pretty common too. With these mommy makeovers, typically we're also going to add some liposuction somewhere, anywhere that you may have some residual fullness that you don't like. That could be in the kind of armpit area, the preaxillary area we'll call it, on the outer chest walls, and really commonly it's going to be the lower back and the flanks. And that's going to really complement the abdominal procedure and really kind of restore that hourglass figure.
It doesn't necessarily have to be brand new moms. The typical age range is somewhere in the 30s to 50s, but we certainly have women in their 60s and even 70s that want a rejuvenated abdomen and rejuvenated breast, and certainly they're candidates.
So typically we're going to wait about 6 to 12 months before we're going to want to pursue any kind of surgery. We just want to let your body recover from everything that it's gone through before doing any type of surgery. This lets the abdominal wall do as much shrinking up as it can on its own, and the skin to tighten up as much as it can on its own. And we want to make sure the breasts have gone through the whole milk process, and definitely waiting to 3 to 6 months after you've stopped producing milk before we're going to do any kind of breast procedure as well.
So I think it goes without saying that it's important to have completed your last pregnancy and remain at a healthy, stable weight prior to undergoing these body contouring procedures, because our goal is to help you achieve either the body that you had prior to pregnancy or the best version of yourself that we can help you achieve.
I would agree, and I think it's probably the most satisfactory procedure that we do. I think that's why it's both of our favorite procedure to do. A lot of happy women, we get some great results. It really makes you feel back and whole, and just gives people that confidence back that they once had, and it's kind of your time to enjoy that now. So you can always find more information on these topics on our website, www.plasticsurgery-stl.com, and on our social media. If you check those out, make sure you follow, like, subscribe to us on there. If you have any extra tips or recovery or your own experience you want to put on there, go ahead and put them in the comments, and we'll make sure to get back to you and answer whatever questions you have.